Well, what's going to happen is you're going to have telltale signs. A lot of people with poor hip mobility actually don't balance well when they're on one leg. So if you can't balance in a very, very stable position, and let's just give the listener at home, I mean, if you're a physical therapist, most of the research says if your patients can't balance for 20 seconds in single leg stance, there's a slight stability issue. If they can't even balance for 10 seconds, there's a significant stability issue. We are not to assume that the stability issue is a weakness problem until we demonstrate that mobility is present. If mobility is not present, you don't have the adjustability to make those subtle adjustments in your posture to balance, because I'm not saying you got to balance 20 seconds like a statue. You can make subtle adjustments with your foot, your ankle, your knee, and hip. I just don't want you bobbing your head, dropping your shoulders, and using your torso to manage your balance. Your balance should be managed in your lower extremity. And when we see restrictions in the hip, we see poor angles and postures in the pelvis. When we see poor angles and postures in the pelvis, we ask you to stand on one foot, and all of a sudden, you stick one shoulder blade in your ear, you contort your neck to one side, you start flailing your arms about as if you're on a rocking ship. And that's not balance. That's survival. You know, balance is poise. Balance is stand on one foot and don't spill your beer, or stand on one foot and balance a book on your head. And you will make all the adjustments below your waist. A mobile hip will allow that to happen. So the assumption is, when we see poor single leg stance, we automatically assume, if your glute medius is not firing and we need to do muscle activation. Well, if your hip is not aligned and your pelvis is not level, then the first thing we're asking you to do is, hey, I'm going to give you a balance test in poor alignment. Well, if you're not in optimal alignment, how can you have those resources that allow your vision and your inner ear and your ankle receptors and your knee receptors and your hip receptors to have you keep a level pelvis, level shoulders, and a level eye line in standing? So the first assumption is, when you have poor balance, that it's a strengthening problem. It's never, ever a strengthening problem till you remove the mobility issue. If you have poor mobility, not only do you have less options to balance, but this is my thing. When your mobility is not optimal or it's asymmetrical between sides, then you must realize that your perception is distorted. Your muscles have as many spindles in them to help you receive information from muscle tension and joint alignment as they do to receive messages about contraction. So the human muscular system is used equally as a sensory organ and a motor organ. And many times I think trainers and physical therapists forget that if you can't perceive, you can't behave. If you cannot perceive correctly, you cannot behave correctly. And the one thing babies enter the world with is unrestricted mobility. And so their acquisition of movement is largely this rich perception. But if you have a stiff ankle and a stiff hip and you're really stiff in your upper back, and I say balance on one leg, you're going to have to use your low back and your knee and cave your knee in and contort your low back to balance. If I assume that's a strengthening problem, then I'm assuming that your perception is normal and you just need to get stronger. And I would venture to say that the majority of those problems you see, these people aren't perceiving the same things you perceive when you stand on one leg. Their options are reduced, so their compensations are increased.